This is regarding the clash of the different systems of medicine. The modern medicine declares itself as the scientific system of medicine based on modern scientific principles, and it treats the other systems as traditional and mostly not concurring with the scientific principles of modern times. But the fact is, these traditional systems followed science as it was prevalent at that point of time, and it does not comply with the scientific rigor and procedures required in modern times. But in modern medicine at this point of time is again, to a great extent, not fully scientific, because in future medicine would be mostly at the cellular level, because most of the pathogenic processes happen at the cellular level. Modern medicine currently treats the pathogenic conditions by neutralizing the output of the cells due to pathogenesis. For example, the modern medical approach is to neutralize the cholesterol, the sugar, which is surplus in the system, but it doesn't tackle the cellular changes which led to the surplus of these chemicals in the system. So this, to a great extent, from a futuristic angle, would be most unscientific. It's a kind of symptomatic, it's a variant of the symptomatic therapy. Mostly modern medicine at this point of time is symptomatic in therapeutic approach. Even tackling pathogens, for example, to produce a vaccine, at this point of time, modern medicine has only reached a stage where it has to use the pathogen itself in its attenuated form to create a vaccine, and the vaccine in turn creates antibodies and immunity. So it depends on the pathogen itself. There is no mechanism by which it can induce the system to produce the required neutralizing antibodies or IgGs as required to tackle the pathogen. Similarly, modern medicine depends on antibiotics, antiviral drugs, etc., which are actually a chemical process of destruction of the pathogen, and it doesn't render the system, the body, power to resist this pathogen. Ideally, the scientific approach to this treatment would be strengthening the system so that it can, one for all, beat the pathogen and prevent any further infection from that particular pathogen. So modern medicine is also in a crude and developing stage as at this point of time, and corrections at the cellular level is beyond the reach of modern medicine mostly. And modern medicine is today mostly symptomatic in approach, or mostly correct the end effect of a pathogenic process. It doesn't correct the origin or the source of the pathogenesis. It simply neutralizes the end products of the pathogenic process, like what the hypoglycemic drugs and anti-cholesterolemic drugs do. That's not the way to proceed. You should be able to tackle the cellular process of control over these end products, production of these end products. So, to a great extent, modern medicine is also unscientific from a futuristic viewpoint. So, blaming the traditional systems which were scientific according to science of olden times is not really fair. But one thing is for sure, many of these traditional medicines have actually proven their efficacy and efficiency in handling at least some of the ailments. There is no shadow of doubt about it. But then they will not be able to explain how. They will not be able to explain the pharmacodynamics of the end result. But then there is concrete evidence which has been reinforced over time that these medicines are truly effective in correcting certain ailments, especially chronic ailments. So, blaming a system of medicine for lack of scientific evidence as the scientific procedures that are prevalent at this point of time would be unfair. Modern medicine itself wouldn't stand the testing or the scrutiny of a future system of medicine or the future stages of modern medicine. So it's all, what's scientific today is most unscientific tomorrow, simple as that. So let's not blame any system, let's go by evidence of clinical result, which many of these traditional systems do have. So let's not, challenge each other. Let's not try to, nullify each other. Let's take a holistic approach. That's what I would like to say. Thank you very much.